we're here today. My name is Peter. I'm the executive director of the Northwest Accountability Project. We are a watchdog organization that's dedicated to shining a light on the moneyed special interests that seek to bring an agenda of hate and division to folks in the Northwest. And we are very lucky to have Dr. Daniel Morris, a PhD in public health, to talk today about some of the safety measures that are being implemented in the Northwest to protect people during the pandemic, and what fringe right-wing organizations are trying to do to undermine those safety measures and put us all at risk. So I want to thank Dr. Morris for joining us today, and I want to thank all of you for watching here. So Dr. Morris, just tell us a little bit about yourself, your background in the field of public health, and for folks that don't know, what do public health experts actually do?
Sure. I'd be happy to. And again, thanks for the opportunity to talk with you today.
Yeah.
I'm a doctor of public health. I used to work as an epidemiologist for the Oregon Health Authority. There I focused on chronic disease prevention and environmental public health. Public health is a big field. It covers lots of different areas, from restaurant inspections to running safety net health clinics. But my focus in epidemiology. Epidemiology is an applied science, and it's the study of sort of the patterns and the causes of diseases, not so much at an individual level, but at a population level. And so, the work of epidemiology involves, for the most part, like gathering and monitoring lots of different data, bringing that data together, kind of cleaning and analyzing it and looking for patterns. We especially tend to look for disparities in the data to see which groups are experiencing sort of health problems at higher rates, because those disparities help illuminate those root causes of diseases that then give us some guidance about where we can intervene to not only improve health for those groups, but really for the whole population. So that's kind of where sort of my background and my focus.
Fantastic. And how is the pandemic, which is a once in a century, I think you could say, pandemic, change the field of public health?
I think that the coronavirus has really sort of exposed the kind of the consequence of many years of disinvestment and cuts to our public health system. Public health is one of these fields where when we're doing a good job, you don't really hear about us because people aren't getting sick. There aren't huge outbreaks, and it's really when when things kind of break down, that's when the bad stuff happens. People live a lot longer than they do today than, say, like 100 years ago. I think about the Oregon Trail, video game I played as a kid, and all those diseases like cholera and diphtheria. People don't really die from that stuff today in the States, but we've got it under control because of these public but kind of sadly, because of these cuts, not just to public health, but really across lots of different government areas and public sector, we're really seeing now that no one in Oregon, no community in Oregon is really receiving kind of the full range of public health services at sort of recommended adequate levels, and that really it puts us all at risk just every day, but it especially we're seeing it even more kind of in a striking way when it comes to the pandemic now.
Yeah, and I also think it's a great point that you don't get credit for things that you prevent, really, right? And polio is one of the things that I always come up with, because there's a family member that has post-polio syndrome and got it when it was pretty rampant, and it's a very deadly thing, but we came up with a vaccine for it, and now we take it sort of for granted that it was a really devastating thing. But a vaccine, because of public health experts and public health, was able to really minimize and basically destroy this disease.
Yeah, and I think that's a really good point. And also, I think that maybe what a lot of people don't realize is that, after the vaccine for polio was, created, there was a massive public health effort to educate people about the need for the vaccine, the safety and the efficacy of it. Because at first people were like, well, why isn't everyone lining up to get this vaccine? And so, there are many, sort of health educators. That's actually a big part of public health practice, is communicate both disease risks, but also, ways to prevent and protect yourselves and your community.
Right, because
it costs a lot of money. I mean, that's the, you know, to actually do this on a population scale. So yeah, that's the reality.
That right, and I think the education piece is because you can come up with the vaccine, but if people aren't using it, then it's not going to be a thing. And now, and what's sort of frightening about now is all the anti-vaccination misinformation that's out there. If there is a coronavirus vaccine that's put out there, will people actually take it because of all this bad information that's being put out there? And that's kind of a frightening prospect.
Yeah, I think that's a real concern, and it really will require a big, you know, sort of public education effort around, you know, vaccine efficacy, which is, you know, one of the, I think, one of the reasons why, you know, because vaccines have been so effective, and because these diseases that used to be so rampant, you know, have really got under control, you know, people have kind of taken it for granted that, you know, that they're out there, and I think, partly because of that, and just partly because of other sort of defunding of public health agencies, there, you know, all those public education efforts around vaccine safety have really been ramped way down. And you know, in the absence of the, you know, kind of the strong public messages, it kind of creates this vacuum for unscrupulous groups to come in and spread misinformation, which can be really harmful.
And we want to get into all those unscrupulous groups in a minute here and talk about how they're trying to undermine public health during the coronavirus and how that's all connected, especially to the decades of defunding of public health entities and the public good. But talk for a minute about how the coronavirus actually spreads. And I know this should be something that we all understand right now, but I really want to address this because it's critical to the conversation about these fringe organizations undermining public health measures.
Sure. Well, so the first thing, you know, just to give some context, you know, this is it's a novel, it's sort of a new virus that kind of burst onto the scene, and it takes a long time to actually like gather enough data to really draw strong conclusions. And I think people, you know, maybe kind of underestimate how much time it actually takes, how much work is involved in collecting and analyzing, you know, all these data. There's not like a single sort of central system where everybody feeds in all their case reports. There are, you know, hundreds and thousands of different agencies that, you know, that gather these various health reports, and all has to get kind of filtered and collected. So it takes a long time, you know, for us to, you know, to kind of, you know, kind of get that kind of good information, sort of to have that solid analysis to be done. You know, so what we know, kind of the best of the sort of the best state of the knowledge now is that, you know, it's primarily spread, you know, through sort of respiratory droplets that are produced, you know, when you cough or sneeze or talk or sing or yell, and you know, those little bits of moisture, those droplets, you know, just sort of come out of your nose and mouth. They can then be inhaled or, you know, land on, you know, someone else and infect them that way. That's why wearing a mask is such a critical part of stopping the spread of the coronavirus. You know, because even just like a simple cloth face covering will block, you know, most of those droplets from, you know, kind of being expelled, you know, from your body. And to keep them from, you know, from affecting other people. So when you have, you know, and I think we've seen it in other countries that have been very kind of effective at getting people to mask up, that they've seen much lower transmission rates and are now in a much better place where they're opening up, where you know, their economies are kind of getting back to normal, when we really don't, you know, we're not, the end is not in sight for us. But that's the you know, kind of the main thing we know about kind of disease transmission. You know, and part of that is like the people who are at the highest risk, you know, are those that are going to be spending like a lot of time, you know, kind of in close contact with, you know, with other people, you know, where there's like greater opportunities for them to, you know, to be exposed.
Right. And so let's get into that a little bit too, because you talked about public health officials really studied disparities in public health, and we're starting to see who is more at risk right now as more and more people are infected and more people die from this deadly disease. We're starting to see, you know, it's frontline workers who have no choice. They can't quarantine. They have to be out in the hospitals taking care of patients, and grocery store workers. We've seen folks that who are part of our food supply chain get really sick. Of course, we know that the elderly are more susceptible to the deadly parts of the elderly and folks with underlying health conditions. And then communities of color are seen to be more at risk of this. So can you speak to the disparities and who the coronavirus is impacting the most?
Sure, and yeah, I think it's exactly right that the people who both because of where they live and where they work are just basically are forced to be in close contact with other people are the ones that are in the highest risk. Some of the biggest outbreaks we've been seeing are actually in prisons, even though the data aren't really that good, what are the data that are coming out are really alarming, and not just for people who are incarcerated, but also the people who work in those prisons, the correctional officers and other people, in those environments. But yeah, in terms of kind of occupational exposure, agriculture, manufacturing, nursing homes, all these places where you can't do the job from home, you don't have the luxury of working at home from a computer, and you just have to be kind of in close contact and close proximity. Those are the kind of the workers that are at highest risk. It also turns out that that's kind of probably one of the main mechanisms by which you're seeing the communities of color are kind of experiencing higher rates, because many of the jobs like in agriculture, in nursing homes and manufacturing, that those are kind of disproportionately held by people of color. They also unfortunately, those jobs tend to pay less, and so we're really in kind of this sort of it really kind of seems upside down that these jobs that are so critical for the running of our society, that we all depend on our food getting to us, and depending on if we have loved ones in a care facility, that someone's going to be taking care of them. Those are in many cases the jobs that really pay the least. Right. And so we're really seeing kind of the coronavirus kind of exacerbate existing disparities among these groups. Just one other thing I'd want to add there is that smokers are at much higher risk. COVID presents in different ways, but kind of primarily as a respiratory infection, and people whose lungs are already kind of damaged or diminished from smoking are both at kind of higher rate of catching the disease, and also of seeing the disease progress to to more serious case or to dying from it. So that's one of the really important things. If you're a smoker, this is a great time to quit. If you have if you know people who are smokers, it's a good time to encourage them to quit and seek resources to do that.
Yes, always a good time to quit, especially now. I think this piece on workers, we've come up with a phrase of essential workers, and it's starting to shift. It began to shift in our conversations about the economy, about who is essential. When you think about all the basic necessities that we need, we're starting to talk about folks who work on our food supply chain as essential, which is a different conversation than we have now. Unfortunately, not all essential workers are treated as essential still in this economy. A lot of those folks have union representation, but a lot of folks don't. And for the folks that do have union representation, you have another advocate fighting for protective equipment, fighting for safety measures, fighting for paid sick leave, fighting for hazard pay. And we've really seen the labor movement, as people feel this crunch, the labor movement is being seen again as essential to a lot of workers. And I think that's really critical, and that conversation needs to happen. So I want to get into this stuff about misinformation around the safety measures, because it seems so simple. Wear a mask when you go outside, when you go places, try to stay away from people, socially distance is the phrase that we like to use. Those things are really simple things to do for most people, to wear a mask and to stay away. But we're seeing an incredible amount of misinformation and pseudoscience making its way into the public domain. It's finding its way onto the internet, obviously, and it's being echoed by right-wing leaders and organizations, including coming from the White House. So as a scientist, what's your reaction to all this misinformation out there? And then how do you think the scientific community should respond to this?
Yeah, I mean, it's, just personally, it just makes me really sad, more than anything, it's, essentially, like, as a result of all this, all the misinformation, or just really just lies that are being pushed out. I mean, and it's more sort of understandable, like at the beginning when we didn't really know that much, before better data were available. Excuse me. But like, now that we actually do know better, it's really kind of unconscionable to be continuing to push these false narratives around the efficacy of these measures, and the danger of the disease. We're really looking at a place where hundreds of thousands of people in this country have already died, and we're probably going to see hundreds of thousands of more deaths. And it was totally avoidable. Like, it was this really kind of a sad state of affairs. I think that in terms of sort of like why it's happening, my sense is that there are, like, kind of political polarization kind of drives engagement, and it drives advertising dollars, it drives donations. And so there are groups that are, essentially looking to fundraise off, and kind of make money off of all this misery. And so I think, like, that's kind of one of the main reasons why you've got a lot of sort of vocal voices, kind of pushing these sort of contrarian views. And it's unfortunate. I mean, and I think the other kind of side of it is that, since we've kind of as a society disinvested in public health over the years, we've got kind of fewer strong voices on the other side. We don't have the resources really to push back against this colossal noise machine. And so it's a really challenging, sort of time to, I think, like, to be sort of public health, professional or scientist, and to be working. And we've seen really across the country, lots of health officials are getting fired because the elected officials that they answer to, don't like the recommendations they're hearing. They're choosing to believe what they hear, like from other sources. So so it's really too bad. It's there's so much death and suffering that was really avoidable, and that's the situation we find ourselves in.
And I think there's an anti-science movement that's been growing. There's always been an anti-science movement throughout all of history, but now we're starting to see it in real ways and make itself into the mainstream, and a lack of understanding of science. And scientists aren't here to tell you what you want to hear. Scientists are looking for the truth, and they're going to tell you the reality of certain things. And sometimes that reality is uncomfortable. Sometimes that reality means other things have to suffer. But we are in the midst of a once in a century pandemic. And it's really sad to see how many folks are ignoring the scientific community or don't understand the science and how the scientific process works, especially when you're studying a novel virus, a new virus that we haven't seen before, that, as more and more data is accumulated, things may change a little bit. But now that we do know quite a bit, we know that certain safety measures do help slow down the spread of those. And masks are a huge part of that. So I really want to get to the next question. It goes to another point that you just made about how polarization leads to raising money, right? And divisiveness can lead to raising money. And as you know, the Anti-Worker Freedom Foundation is a group based out of Olympia, Washington. They have tried desperately. They've invested millions and millions of dollars in trying to destroy labor unions in Oregon and Washington and California. They're funded by this web of out-of-state special interests. And they've really failed. They haven't gotten a lot of attention. They spent 5 years doing this, spent more than $20 million. And they just can't, there's no power that's strong enough to beat working families. And so they've been a complete failure. Now they've pivoted to really pandering to this sort of fomenting fringe right-wing base of activists by peddling misinformation and pseudoscience around these safety measures. They've regurgitated every right-wing talking point on COVID. And you can see them just like as they're going around promoting their anti-science agenda, they're constantly sharing their donate page, like, let's raise money off this. Hey, if you like what we're doing, raise money off this. And they seem to be getting some traction with a very small group of loud, fringe right-wing activists. Now they're suing the state of Washington because of Governor Inslee's mask requirements. And it's a DOA lawsuit, and I think they know that, but again, the lawsuit helps them raise money. So can you talk more about this? Like, what's your reaction to a group like this pivoting? A group that once said all we do is focus on destroying unions is now focused on undermining COVID-19 safety measures.
Yeah, I think you just have to follow the money. I think like that kind of tells you everything you'll need to know. It's essentially like to kind of mount a strong public health response. That takes resources, right? And the resources that we currently don't have in the system. And so, so essentially, if you need more money, you're talking about raising taxes, at some point. And kind of any discussion around raising taxes, it sort of naturally begs the question, well, who's paying now and who's not paying their fair share now? And I think that like there's probably pretty broad like kind of recognition across the board that the big corporations and the billionaires are paying a much smaller share of taxes than sort of working families are in regards to their income. And so so I really see the kind of the efforts of these groups that are funded by funded by this sort of conservative right wing kind of billionaire class as trying to kind of erode trust in the government, in just sort of the public sector, and to get people to think that there's no need for making these investments, so that to kind of head off efforts to raise their taxes.
Yeah.
And you say like they've spent $20 million over the past few years like ineffectively, but if you think about like the billions of dollars that the state would actually need to raise, or potentially even the trillions nationally, to kind of effectively implement these measures.
Yeah.
It's a small price to pay, right?
It's a drop in the bucket.
A drop in the bucket, and especially as over the years we've seen income inequalities sort of skyrocketing as the tax rates on the wealthiest and on corporations have been cut and cut and cut. They just have more and more and more money to spend funding these operations. So I think it's really just about following the money. I think that kind of tells you what you need to know about what their real agenda is.
And I think that's totally right. And it's been the same groups that have spent decades trying to divest from public health measures, the state resources, divestments from education, that have really are now the same groups that are at least the same funders and that same sort of right-wing apparatus that are pushing these this misinformation around COVID. And it's really made its way up into the White House. It's made its way to the highest level of the American government, and that's really disturbing. I mean, the good news is, though, what we're seeing is in the public, a lot of this stuff is falling flat. That polling shows that the public approves in a massive way of safety measures that have been taken by states. So Governor Inslee's approval rating on this is like incredibly high, up in the 70% percentile, and same with Governor Brown in Oregon, that we're really seeing the public understand why this is good. So these marginal fringe groups are being pushed to the side, but they are still peddling this. It still is unfortunate, and we still need to kind of combat that and fight back against that.
Yeah, and I think that like, if you're kind of early on where we were seeing, like New York was, had like kind of the biggest,
right,
kind of the biggest early on. And I think a lot of people in a lot of the country were thinking, well, that's a New York problem. It's not, going to be affecting me. And so they were maybe a little more, sort of willing to accept, the messages they were hearing from, Fox News and so forth. But like once people, start getting sick and dying, it becomes a lot harder to ignore stuff. Right. And, with so many people, really hundreds of thousands, well, really millions of people around the country that have tested positive for the disease that are, infected, and the hundreds of thousands that have died so far. Like, it becomes just increasingly difficult to kind of ignore the actual consequences of, of kind of like of the rejection of these public health measures. So I do expect that, people are getting, they're wising up to, because you can't ignore the bodies that are piling up.
And I think that when you look at who's most impacted, we talked a lot about this, but communities of color and frontline workers, many of whom are lower wage frontline workers, that's another reason I think these groups want to ignore COVID, is because they're just not that interested in these folks and protecting them. Right. And it's another reason why the labor movement has gotten so popular too, because we're seeing the labor movement really step up and protect people on the front lines. One last little bit of disturbing irony is that the organizations, even the Freedom Foundation and the Washington Policy Center, which are both part of the same right-wing apparatus, actually got PPP money from a COVID relief bill that was intended for small businesses and local communities. So out of one side of their mouth, they're talking anti-government, cutting spending for education, cutting wages for public sector workers, undermining the public health. And on the other side of the money, they're taking this government aid. And we've actually launched a petition that folks can go to on our website, nwaccountabilityproject.com, to ask them to pay that back. So ending on a more positive note, how can everyday Americans help fight COVID, especially against these forces that want to spread information? Most Americans are not on their side. They're on the side of protecting the public health. And what resources can we share or organizations that we can support and look to during this time?
Yeah, I think that's a really good question. Well, I think first, the Centers for Disease Control, that's the first place I look to for sort of health recommendations. I think they're still like the most kind of reliable sort of unbiased source for this. So I would just encourage people to get your information from the CDC and not from Fox News or QAnon, right? I think that I would just encourage people, just set a good example, wear a mask when you go out, limit your outings to places that are, to the grocery store, to the, to stores, figure out a way, there are people who have to work, they have to work in the stores, and we need to do our part to help protect, people who, to help keep them healthy. Ultimately, the more people that are sick, the more at risk you yourself or your family is going to be. So, so this, I don't want to think, I hope that people aren't thinking about it. I know some are, but don't think about it as an us versus them, but there's we're in this together, right?
Yeah.
We, and the more we can help others, avoid getting infected, the better chance we have of keeping ourselves and the people we care about safe. And then finally, again, smoking is it's always a good time to quit smoking, but now's a really good time to quit smoking. That it's one of the, we know it's already one of the leading kind of preventable cause of death and disease in this country. And quitting smoking now is going to greatly reduce the risk of having a serious case of the coronavirus. And there are resources available. Everyone can just call 1-800-QUIT-NOW to get linked up to resources they need.
Awesome. Well, we appreciate Dr. Morris taking the time. We're going to let him go. I see it's time for dad time because his kid's roaming around in the back, which happens during these quarantine times. So I really appreciate you taking the time and talking to us about this. Thank you to Dr. Morris. And if folks want to learn more about us and the organizations that are trying to undermine these public health measures, go to nwaccountabilityproject.com. We also much appreciate any donations and support. We don't have the deep-pocketed billionaires funding us that the others do, so we really rely on grassroots support. So again, thanks, Dr. Morris, for joining us.
Thanks. Keep up the good work.
All right. Take care now.